me being here makes it more of a connection, not just because I speak Spanish or I'm a brown person, all that stuff, but actually I come from the community. So I always see myself as like a role model, like, oh, this person grew up in the developments. She went to college and now she's working for her community. And I feel like everybody has that power to give back to their community.
Many of the staff that work here are from the community. It's a familiar place. People will come here way before they'll go to the hospital.
The original model for community health centers was really an experiment at the time that was radically different than what had previously been offered. They really recognized that healthcare had to be delivered in a community setting, with the community directly involved in developing the priorities for how care was delivered. And that care had to encompass all the different components of what goes into making us healthy.
There's the community center, the pool. It has a WIC office on site, and there's a food pantry. They give out food. There also is a farmer's market on site. The fresh food truck has a site just across the street.
All of that is a acknowledgement, that these are the social determinants of health.
Dot House is not as well funded as the big hospitals, but they just have really thought about what the needs of the community are and are really trying to address those specific needs.
And at a time when I think a lot of clinics have really had to pare back their services or programs because of the lack of funding, Dot House Health has continued to commit to maintaining those community programs.
I've noticed that a lot of our children don't get the mental health services. When they get older, it's a lot of dysfunction, a lot of trouble, and people don't understand where it's coming from, when in reality, we should have caught it when they were babies, so that way we could have helped them. And so knowing that Dot House was doing that, I was very excited about that, because we can catch it early. That's all I ever wanted to do.
Medical home is almost synonymous with community health center, and for us, South Boston Community Health Center is the home base for families from the community of South Boston, Dorchester, Roxbury, the South Shore, and people have a fierce loyalty to this idea that no matter what health issue comes my way or my child's way, I know that I can get in to get support, certainly for the medical things that come up, but because the community health center model, and more so with an approach like Team Up, there's all these other helpers and services on site. So it's like the one-stop shop for wellness.
Whether pediatricians acknowledge it or not, they're always dealing with mind, body, parents, schools. So all of that is always present. I think by calling it out that we're increasing the expertise and understanding of how behavioral health impacts a child's development as well as their physical health is just renaming and reorganizing.
I'm a pediatrician, and what we saw during the pandemic, particularly because of the first year and a half of remote learning, was that children and families were experiencing a tremendous amount of unmet needs. And that contributed to both more frequent behavioral health symptoms and medical symptoms, as well as more intense symptoms.
What COVID did was make us have to adjust to where people are, right? And in any social work, psychiatry training, that's the mantra, right? In a weird way, COVID actually gave us some tools to meet people where they are. We had the opportunity to talk to people on the phone, video calls, but to really be able to talk to people without them having to drive, without them having to get the kids out of school. And it gave us an opportunity to access our families and for their families to access us in a way that we just couldn't before.
The changes that we made to both be prepared to deal with more acuity and to do a better job of universally checking in with patients or screening patients for symptoms, as well as redesigning how we think about a patient visit, including telehealth, will continue as we recognize that these are the ways that patients actually find services easier to access.
I think it is different because it's where the kids are, and anytime you're seeing a problem and then trying to get help that's somewhere other than where you are is a chance for things to be missed or slip through the cracks or a connection not to be made. So it's just common sense. Families from our community know our health center, they trust our health center. It's a place where they already have a foundation of relationship with a trusted helper, and it's good medicine.